Hello everybody, I am Dr. Pourmatrud and today I am going to talk about the polycystic ovary syndrome. This disease affected women from menarche till menopause. Menarche means the first time when a girl experiences menstruation, and menopause means when the cyclic menstruation will stop. Polycystic ovary is one of the important causes of ovulatory dysfunction. Another causes of ovulatory dysfunction are hypothalamic anovulation, hyperprolactinemia, premature ovarian failure, and age-related ovarian failure, and sometimes luteal phase defect. Anovulatory disease means a lady couldn't experience ovulation during 1 month. Hypothalamic is a gland in our brain. Hyperprolactinemia means elevation of prolactin, which is an important hormone or substance in our body. Premature ovarian failure means stopping in ovarian works under the age 40, and another cause may be related to the advanced age after 45 years old. Ladies most of the time experience anovulation cycles. Ovulatory dysfunctions consisted 50% of all of the infertility causes. Ovulatory dysfunction sometimes is with menstrual irregularity. Sometimes there isn't any specific basal body temperature changing, and sometimes in ovulation prediction kit that is works with the urine sample, we cannot see ovulation signs, and there isn't also elevation in progesterone level in the blood. All of them could predict ovulation dysfunction. As you see in this picture, in normal ovary, you can see some few follicles that each month one of them is grows and produce one mature eggs. But in polycystic ovary, in right side of the picture, you see the ovary size is at least 2 or 3 times bigger than the normal ovary, and there is several small follicles around the ovary. Those small follicles produce an elevated and abnormal level of androgens or male hormones that all of them brings about all of the hyperandrogenism sign and symptoms in a lady, which will be discussed later in our pictures. The prevalence of PCOS, of course, according to previous studies, is about 10 to 50%. But according to our experiences, which can we see due to sedentary lifestyle, using more fast food or high oil products, the prevalence of PCOS has been increased dramatically during those years, recent years, and at now the prevalence is much more than 50%. In some societies, that the because of their poor habits of living life and using alcohol or tobacco and sedentary lifestyle, the prevalence is much more than 50%. Okay, we want to discuss the symptoms and how we can diagnose the polycystic ovary syndrome. PCOS means polycystic ovarian syndrome. For the first time, it was named by Sten-Levenstad syndrome, and it is one of the biggest and important factor related to infertility. And even after age of 75, doctors have discovered this syndrome in women. How we can diagnose a PCOS in a patient? After exclusion other important etiology for the anovulatory cycles, having those signs and symptoms are related to PCOS. Oligomenorrhea or anovulations means a lady couldn't experience every month regular menses. Sometimes for 3 or 6 months she couldn't experience any cyclic menstruations. Sometimes the menstruations is irregular, but they experience other signs and symptoms like hyperandrogenism, acne, baldness, or having hirsutism. It means excessive male type hairs in special parts of body, or oily skins. They are kind of hyperandrogenism signs. And sometimes in sonography we can diagnose the specific patterns of ovaries, which are 2 or 3 times bigger than normal ovary in size, and they have too many small follicles, less than 8 millimeters, and sometimes the stroma or the connective tissue in the ovary is very high amount. For the first years, when the physicians describe the PCOS or polycystic ovary syndrome, they considered 2 of those 3 signs should be obligatory for diagnosis. But nowadays, just having one of those signs or symptoms is enough for diagnosis of polycystic ovary in a lady. How we can diagnose polycystic ovary in a lady? History is the first place and very important. Having abnormal uterine bleeding, cessation of the menstruation for 2 or more months, seeing androgenic signs in a ladies, like abnormal male type hairs in the chains, in breast, in thighs, having abnormal acne, baldness, or having oily skins are the signs and symptoms which are related to PCOS, and we can diagnose them by complete physical exams. Also in sonography, the ovary have special features. In laboratory findings, there is special patterns in hormones, which some hormones are high and some hormones are low, and male type hormones also are in an elevated situation. Okay. During ovulation, a woman with PCOS syndromes have experienced an abnormal amount of luteinizing hormone production. This hormone LH is secreted by the anterior pituitary, our brain, and because of the elevated level of LH hormone, we can see elevated androgens like testosterone and decrease in FSH and estrogen hormones. In simple definition, the androgen in a lady is higher than abnormal level, and the estrogen, which is the female hormones, is under the normal situations. Because of abnormality of the hormonal secretion from the pituitary and ovulatory, because of that, people's received mixed message. So the ovulation face difficulty, and instead of developing eggs in one cycles, all of follicles accumulated, and they couldn't produce any eggs within a menstrual cycle. Sometimes people who are affected by PCOS, instead of regular menstruation cycles, experience spotty periods, even 1 month, in 6 months, or even in very severe cases in 1 year. And they also could see just a spot instead of regular blood. But sometimes after some months cessation of the menstrual periods, they faced heavy and very severe blood severe menstruation with excessive blood loss. Sometimes it ends to syncope or lowering in blood pressures. We can see here in this picture hirsutism. Hirsutism, as I defined it previously, is excessive blood hairs in male type, which is a dark coarse hairs in face, neck, chest, arms, or between legs. And this is one of the symptomatic importance which is related to PCOS disease. Most of women with problems in ovulatory work or PCOS patients have excessive excessive body weight, but we can see also women who are underweight with PCOS. So every patient that has PCOS isn't necessarily obese or have a high body mass index. Also, another important symptom is acne. As we can see, acne is part of change during a puberty period. But people who are suffering from the PCOS because of the excess male hormones experience acne most of their lives, from the puberty until the even menopause. And we can see acne not only in the face but also in the arms or back arms or in chest. We can see them as sometimes they turn to the follicles with pus and makes a very bad feature in the face, because they turn to scars and remain to the end of life with the lady. Another sign is alopecia or baldness, female type baldness. The excess of the hormone, male hormones in a female body brings about losing scalp hairs and front scalp hair line. We can see the alopecia in those areas. Another sign is dirty skin or acanthosis. This condition causes light brown to black rough patches around the necks and underarms, and sometimes because of the abnormality in male hormones, women experience headaches with a special kind of migraines during their menstruations. Okay, what we can see during blood exams. As I described before, the level of LH hormones is high and the FSH hormone is lower than normal. The testosterone is higher than normal level in a lady, and estrogen level is under the normal, sometimes under the normal, and sometimes it's upper the normal level. Also, PCOS patients experience abnormality in their thyroid stimulating hormone because of the elevation in prolactin level, and also they are very very sensitive to glucose intolerance test, and they could experience diabetes mellitus during their lives, and also they are in a high risk for cardiovascular attacks and problems in their blood pressures because of that abnormal level of the androgens or male type hormones. Also, in sonography, as I described before, we can see a large ovary with several small follicles, but sometimes the follicles aren't about the normal level, and also the stroma or connective tissue is higher, much higher than normal level. About family history, most of the time we can see a trace of the disease in their first female family, like mothers, like their sisters, or even their aunts. But sometimes there isn't any family pattern related to PCOS. And one important thing is that PCOS is related to genetic predisposing. It could be considered as a genetic disease and must deal with it along the age with modification in lifestyle, having exercise, regular exercise, and preventing using carbohydrate and oily foods very important and crucial for control this disease. Also preventing from being overweight or being obesity could prevent metabolic syndromes that is high blood pressures, high level of cholesterol and triglyceride, or even abnormal sugars in blood flow. All of them could be prevented by special intervention, and sometimes by prescribing special drugs. Related to infertility, there are several approaches for PCOS. Sometimes the first line is induction ovulation by drugs like clomiphene or clomiphene citral or letrozole or other options, which are very specialized and should be covered by physicians. But bear in mind, PCOS could be prevented and could be managed, and you can live with the PCOS ever after happy, but consider some intervention, and very important key factor that be aware of the harmfulness of carbohydrate and oily foods, and also excessive amounts of caffeine and tobacco is very harmful for this disease.